Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And joining me this afternoon is Dr. Rashid Chotani. He is Medical Director of IEM. Doctor, thank you so much for being here again.
Thank you for having me to talk about a subject that is obviously very important to me and you and the rest of the population in the United States of America.
Yeah, we want to start off, Doctor, by talking about education and the coronavirus. What are we seeing right now within university systems, and why do you think we're seeing it?
So, there are about 1,000 four-year institutions, over 1,000 four-year institutions in the United States of America. And we've got different academic institutions coming up with different strategies. Some of them, about 450 said that we'll have full in-person classes. 45 said that they would have in-person classes. 450 said they would have a hybrid model. And then, and it's different for different places and different institutions. But what we've noticed is that even if the institutions have come up with really good strategies of testing and tracing, they have not been able to control the epidemic that is, or outbreaks that have happened in those institutions. Now, you know that Chapel Hill had to shut down, and a few other institutions, send their students back and they emptied the dorms. The problem is not that the universities are not doing the right thing. They are trying their best, but how do you control young individuals who are going in for the first time or second year or third year or fourth year, and then all of a sudden they are completely free of any type of restrictions, and stop them from going to bars and congregating in different places. It's not that these students are going to get really sick. Only 1%, I believe, based upon some of the data analysis that we've done, will end up in a serious condition or a intensive care unit. But we've got to think about another thing. If they are positive, they are exposing the staff who are vulnerable. They're exposing the faculty that is vulnerable, and then they're affecting the community at large. Because what happens is that an outbreak starts with a few individuals, and then it spreads like wildfire. And then, surely it will affect individuals that are vulnerable in that age category that it's extremely risky. So that becomes an issue. So it is a major problem for academic institutions. How do you really open up effectively and make sure that the students get the rich experience that they need in order for them to get the education that they require, right? And
Right.
And it's become a problem.
Yeah, and when we talk about college, a big aspect of it is socialization. So it is a difficult balance here.
It is an extremely difficult balance. I can't even tell you how difficult it can be. I've been a college student, and you've been one too. And when you go there, perhaps this is the first time that you're away from your home. This is the first time that you essentially feel that you are completely, not being policed, and you can do anything that you want. And I felt, you felt, and these students are feeling the same thing, that they are not vulnerable. They are resilient, and they can, nothing can affect them. And that is true at that age. But the problem again is that if they contract the disease, some of them, a very few of them, will end up with adverse consequences, but a lot of other people that they might come in contact with will be affected in a serious, serious way. And then you will not be able to control the number of cases that erupt across the board.
Yeah, it really is about the spread of the virus. Let's talk now about where we're seeing an increase in cases. And the real concerning part here is what we're seeing in Middle America.
Yes. So, this is, to be honest about it, one of the most amazing things about this disease, and unfortunate thing for us as human beings, is that we have never experienced this before. And now what we've seen is that, you saw the disease in New York and New Jersey just explode, right? And then you saw it exploding in the Sun Belt in a major way. And now, the numbers are going down in the Sun Belt, and all the way to California, the numbers are, because of some of the restrictions that you've imposed. And then all of a sudden we see that in Middle America or the Midwest, there are states that are now reporting a higher number of cases. So that has, that is going to be something that we'll have to continue to monitor, continue to be vigilant about. And, again, it always happens once you let your guard down and you relax things. And we know that if you're going to relax any place, we are going to see increased number of cases. We knew that when we were going to open up colleges, the number of cases in certain areas is going to increase. But again, the problem is that we are not in control of the virus, and we were unfortunately not able to contain it early. And now we are paying the consequences because, although the numbers are going down, but look at the total numbers, right? They're not really at a point that we should say, okay, my God, we are okay now. Our deaths are still 21 days of more than 1,000 deaths every single day. And deaths follow 2 to 3 weeks after the number of cases go down. So we should unfortunately be seeing the number of deaths for the next 2 or 3 weeks as high as they are today. And I hope I'm wrong, because I really do not want anybody to die. But that is what the reality is right now. So again, if we let our guard down, that's what we're going to face.
Yeah, well, we can't afford to do that. Let's talk now about the vaccines and how things are going there. Still on track, do you believe, to have one, maybe not for distribution by the end of the year, but at least a vaccine identified by the end of the year?
So I honestly believe that, because the manufacturing started already, and we have already, as US has given money to Moderna as well as the Pfizer consortium for 100 million and 100 million in one case, 100 million in another case, vaccines to be ready by November or earlier. And it's being manufactured. As it's being manufactured, the phase 3 studies are going on, which involve approximately 30,000 individuals. And so far, everything looks okay, except one particular problem. The problem is that these studies are not able to enroll enough minorities in them. So we don't know exactly, what the real effect of this efficacy of this vaccine is going to be on minorities, and what potential side effects are going to be there, because every, African Americans, Asian Americans, Caucasians, Latinos, Latin Americans, they have they react different to different things. And we cannot base all the science that we have on just one group of people that is volunteering the most. Now, we have an issue in the country with the trust issue, in terms of the government saying, come and be tested for a vaccine. And the African American population, because of the experiences with the Tuskegee study, which was a syphilis study, are still, have some apprehension in terms of volunteering for this thing. And then, we have this huge group of individuals that are anti-vaccine, and they are really, really pushing the campaign not to get vaccinated, period. And they're saying this is not the right thing. So unless and until we do that, we control those things, we have a problem. But I do believe that we will have a vaccine ready, manufactured, to be dispensed. And at that point, obviously FDA is going to evaluate and see, hey, is this vaccine safe? Is this efficacious vaccine? And can it be given to individuals? And then we run into the problem of how do you vaccinate the population?
Yeah, you bring up, though, a good point. How do these companies try to get more participation from minority communities?
Well, this is going to be a very difficult bridge to cross. But again, one of the things that I would advise minorities is that if you don't volunteer, and if there are not enough people in the study, in the trial, who are coming from the minorities, we won't know exactly how good the vaccine is going to be in those particular populations. So it is up to the individual, essentially. And I believe that CDC and FDA have to have a very strong campaign so that people, and if, one of the individuals that people believe in and kind of trust is Dr. Fauci. And, those messages need to come out from the head of CDC, the head of FDA, et cetera.
Yeah, perhaps there needs to be a greater push for more minority participation. All right, how are things looking as we move forward? I mean, we had talked, a few weeks ago about this idea of possibly some areas rolling back some of the regulations. Do you think that is still a possibility, or do you think that where we are right now is okay, kind of the status quo, if you will? or what do you see happening with regulations and things of that nature to continue to control the spread of of the virus?
So to be, I mean, yes, I mean, we've again regulations. We cannot be in quarantine or isolation or completely locked down forever. We have to slowly ease things out. And the way that we are seeing things is now everybody's following data, and which is a really remarkable thing. Some of the legislators initially, when they were told to mask, they were not masking. Now they're okay with that. Some of the legislators are taking this huge risk of locking down when they feel that it's the right thing to lock down, and opening up when it is important, when they think it's the right thing to do. Right now, again, the big problem that I see as we open up facilities is that it's closed indoor facilities where you have a large number of people, and I'm sure people who own nightclubs and bars are not going to like what I say, but that is a hotbed of dissemination of the disease, and outbreaks can occur through that. We've got to be very, very careful. Just take an example of New Zealand. One family being quarantined in a hotel, and they were not following all the guidelines, and they had to lock down Auckland, the whole city, because there was such a major outbreak that was happening. Again, colleges, you see that, these young, healthy individuals are going out and partying, and then all of a sudden, you have this outbreak. So again, the message is for the young ones, specifically for across the United States of America. You've got to wear the mask. You've got to observe social distancing just for a little bit longer, and you will contribute in saving so many lives that I can't even tell you. Because don't forget that in October, November timeframe, as we look at the southern hemisphere, in the northern hemisphere, we will have influenza. Right now, in the southern hemisphere, the numbers are pretty low in terms of influenza because of the lockdowns, because everybody's wearing a mask. But if in the United States in October, November timeframe, we stop wearing the mask and we are stopping the social distancing, influenza is also going to be jumping up like anything. And then people will not know if they have influenza or COVID-19, and hospitals are going to be overwhelmed with individuals that will be going in there to be tested, and we will not be able to test them and compare and contrast if they have influenza or they have COVID-19. So we are not done with this thing as yet. We have still a long way to go. Once we have a vaccine, things will get a lot better.
Yeah, but obviously, flu season going to present a whole nother challenge. One other thing that you expressed some concern about, Doctor, is what you're seeing in Mexico, how that might affect us here in the U.S.
Well, in Mexico, the numbers are going up, right? South America, the numbers are going up. Mexico has a ton of infected people, and their crude case fatality rate is pretty high too, because of the healthcare system that they have over there. Which is not as good as the United States, and we have a very porous border. We have a lot of economy, and we have a lot of people traveling in and out of Mexico across the border. And that is going to be a problem now if we are able to contain our problem, which I am kind of hoping that we do. And Mexico is not able to contain it, and then some people from Mexico come into the United States carrying the virus, then we can again have a little bushfire that can start a major outbreak or an epidemic. So we've got to be very careful and cautious. We've got to make sure that our borders are secure in terms of testing individuals who are coming into the country. And to be honest about it, just the temperature check for me is not the way to go, because, 80% of the people are asymptomatic, right, who are carriers. So how do you know if somebody is a carrier and is walking in, doesn't have any fever, and then is spreading the disease? So we've got to be careful. We still have to come up with a good testing methodology. Now, I am really, really, really looking forward to the saliva test that has come out, and Harvard is coming out with one, which they're saying that it's going to be so affordable that everybody can use it on a daily basis. And if that is the case, I mean, that is what we are looking for, to be honest about it, so that we can test ourselves. So hypothetically speaking, if I get up in the morning and if I have a test that's very inexpensive and I test myself and then see if I'm positive or negative, can I go to work or not? I'll know at that point. Even if the test is not 100% sensitive or specific, even if it's 70% sensitive or specific, if I do it on a daily basis, then at one point I'll catch myself if I have the disease, and which is better than what we have today. So I'm not looking at a 100% solution for testing. I'm not looking for 100% efficacy for a vaccine. If it's 50%, I'd be very happy, or more than that. And that is because of some of the data that is coming out right now, and we're still waiting to see it. If 50% efficacy is good enough to have herd immunity, but there is some promising data on that. But we still are looking at that.
Yeah, that saliva test could be a real game changer. Okay, final topic, and you just mentioned it, this idea of herd immunity. First of all, explain to viewers what that is and whether or not it's achievable here in the U.S.
So with, what most of the diseases, what we are looking for is about 70 to 80% herd immunity. So that means that 70 to 80% of the people have immunity to the disease, right? So there are two ways to have immunity to the disease. Either you are exposed to it, which is not going to be possible in the United States, because when we look at the seroprevalence of the disease, it'll take us a long time to get there. Even if we open up everything, it's not going to happen. The only way that we can achieve that in the short run and quickly is to have a vaccine. So that means that 50 to 60 or 70% of the people that are exposed to the disease will not develop the disease, right? So if they don't develop the disease, they cannot transmit the disease. So that way you break the chain of transmission in a big way, and that is the herd effect, right? So you have a herd effect, and then a lot of people will also because of one person having the antibodies, and somehow the disease, absolutely from a scientific perspective, not somehow, scientific perspective, the dissemination and the propagation of the disease slows down, and then you can actually do some serious containment of the disease if it still isn't, and it'll still be there, but we can then contain it. Then we can do the contact tracing, because which is impossible at this point with the number of cases that we have. And I feel terrible for the health departments and even CDC and everybody that has been talking about contact tracing, and why we don't have contact tracing up to date as yet. We just don't have the human resources to do that at this point, because you require a lot of people. And the same thing is true for testing. Although one of the things that we've seen in the past few weeks is that the testing has gone down, and we're just testing individuals that are now positive or have positive symptoms or are symptomatic. And yes, if we do less testing, yes, we'll identify less cases. And that is one reason that the numbers might be going down. But we still need to deal with testing and tracing and containing the virus. And the only thing that we have right now is, even if we want to open up our economy, and it's opening up, is that we do social distancing, wear a mask, which is difficult to do, I understand, but we've got to do that to save lives.
Yeah, we certainly do. All right. Well, Dr. Chotani, always appreciate it. COVID-19 researcher and infectious disease expert and medical director there of IEM. Always a pleasure. Thank you so much.
Thank you so much for having me again.